Welcome to Generous Impact. This is Brett Brummett.
And this is Amanda Brummett. We are joined today by Michelle DeGrate, Executive Director of Lightpath Health. A big thanks to Tawnia Wise for the introduction. When Tawnia says that a nonprofit is doing good stuff, you know it's true. In this episode, you'll hear how Lightpath Health is dedicated to developing and investing in programs that expand access to primary care for those without health insurance in the communities that need it most. Well, Michelle, thank you so much for being here with us today and taking time out of your very busy schedule to share Lightpath Health with us.
Thank you for having me. I'm really excited to be here.
Yeah, of course. Well, I'd love to start with your background. You have such a fascinating background, both public, private sector, nonprofit. And so tell us a little bit about who you are, both professionally and personally.
Well, I'm a Texas native. I grew up in Central Texas and then made my way to the DFW area where I attended North Texas and got my undergrad in social work. And then later in my career, got my graduate degree at UTA in social work as well. So I always tell people having a twin brother, I think I'm a social worker both innately and by career choice. I've, grown up taking care of my brother and being big sister, as well as just always having a heart for serving others. And so if I were to, lament about what people will say about me or my legacy, I think I would be most moved if people said that I had a servant heart. And so that's kind of been my North Star and what's driven me both personally and professionally.
And legacy is being our first Movin' Mavs guest. So finally, I have an alumni associate on the podcast.
Oh, yeah.
Brett, do you want to tell everybody what a Movin' Mav is?
That is a UTA
yes.
student. Yep.
And we're getting sports. And so I'm so excited. Our basketball girls are doing really well. And so I'm like, more people are going to know about UTA soon.
Brett's been talking about the wheelchair basketball team at UTA since I met him.
Oh, it's fascinating. And that's huge. And the baseball team has been good over sometimes. And football is just non-existent since the 50s.
Yeah, no. But I'm a basketball girl, so I've been just waiting for the women to kind of get on the map, and they've been doing really well, progressing through all the divisions.
Well, servant heart, going through all the other stuff, moving, doing that, ending up at Lightpath Health. So what was the catalyst, no pun intended, for starting Lightpath Health?
So my career started off in nonprofit. I always just, I think coming out of high school, I was like, I'm just going to save every child that potentially I could see myself in, right? And so I started off working at Child Protective Services and then worked in foster care, but really kind of always anchored on this idea that a stable household is the way to make generational change. And so in working at Christian Community Action, I started off working directly serving households and helping them with housing stability and food insecurity and working to address health inequities, and really have always just viewed my impact in the world by how I'm able to, impact the community that I live in. And one of the ways in which I did that, and which I found kind of a natural disposition, was in fundraising. While I was at CCA, I was part of a really big grant program, and we brought in a fairly large $2 million grant to address housing inequity. And then that was my eureka moment. And I was like, direct service takes a lot out of me. Maybe I'm more positioned to do the macro work. I made the transition from working direct service and direct practice in social work to really focusing on fundraising. And in moving into fundraising, my career just really kind of took off. I was doing fundraising for Christian Community Action. As I've mentioned, I was there for a little over 9 years. And then all Texans, I moved to Austin and did fundraising for Goodwill Central Texas, as well as fundraising for UT and UT Systems. And during COVID, decided to move back from Austin back to DFW and worked at UT Dallas. And so the catalyst for, I'm circling back, the
Yeah.
catalyst for me joining Lightpath Health really was because as much as I loved fundraising and as much as I'd learned throughout my kind of career trajectory and moving through all these spaces, I'm best I'm best driven and I'm best motivated when I'm working for an organization that has a really clearly defined mission. And higher ed in Texas in this season just seemed a bit out of alignment with me right now, with me being both Black, both female, representing a lot of the diversity, equity, and inclusion that otherwise was being revamped and reimagined in higher ed universities in Texas. And so between the two of wanting more of a mission driven environment and the changing climate of higher ed in Texas, I just I just went seeking and kind of opened myself up for the next opportunity. And I had the ability to connect to Lightpath Health through Catalyst Health Group. They were looking for an executive director that would take their fairly young nonprofit organization, Lightpath Health, to the next stages. And I felt like my skill set fit and just was really excited about the opportunity to just get back to the community and get back to serving those in need.
Well, and how fun to find a spot that gets your soul moving and is really back in that personal alignment, because that's empowering to, number one, have that alignment between work, life, and personal values is fantastic. I think we take it for granted that not everybody has that,
I definitely
and to be
agree.
able to
I
do that.
definitely agree. It makes getting up and going and doing the hard work a lot easier. I definitely say that.
And what a life moment to have that intersection where you've built your career and you've gotten really good at fundraising, which, most people hate fundraising. So, you weren't in that. But I love that
I
you're
wasn't I wasn't going to point out that like you're the unicorn that excels at that,
yeah. But I love
which
that
is
your
amazing.
heart drove you back to, taking care of the people that need it most. Because I think we can all agree higher education is super, super important, but not as important as food insecurity and housing and things like that. We've got to meet people's basic needs before we can, help them achieve great degrees.
Definitely upward mobility starts with basic needs. And often in higher ed, while we're doing really amazing work and we're preparing for the future with amazing research and innovation, and we're providing scholarships to community members that are making that leap forward, there's a few steps before that that are required to get people there. And so I just tend to drive and thrive more in that space. And so I was excited to find Lightpath Health. And I always say Lightpath Health found me and kind of like gave me the opportunity to shift my focus and realign with myself and my purpose.
Yeah. Well, I'm glad you found each other. Well, we've danced around it, but we haven't talked about it directly yet. So can you walk us through exactly what Lightpath Health is and what you guys do?
Well, this is the part that I love to talk about. Talking about myself is not always as easy, but Lightpath Health, I love it. So Lightpath Health is a nonprofit that was born out of Catalyst Health Group. It was born out of Catalyst Health Group for a number of reasons, but what most people don't know is that in Texas has the largest number of uninsured adults in the entire nation. And then, so as staggering as that is, that's enough to propel the work forward. But then when you look at Dallas County, and more specifically, when you look at the 8 southern zip codes of the Dallas area, it's disproportionately of an uninsured adult.
Yeah.
And so what we really realized in working in what Catalyst Health Group realized during their work in the southern sector of Dallas during the COVID times, trying to get out the vaccine and trying to get people the health services that they needed, is that there is just no viable resources in that area for healthcare. And so it's what we call a healthcare desert. I mean, many people have heard of food deserts and where there's no grocery stores in miles of residential areas. South Dallas is a healthcare desert where access to primary care is just not there. People are having to rely on urgent cares and ERs that pop up almost in a predatory way, forcing people to pay hundreds of dollars for basic primary care. And so because of that, Lightpath Health just really recognized that gap and are just focused on providing access to primary care for all uninsured adults. And we define adults very loosely because my 16-year-old niece is not hardly an adult, but 16 and up, and without medical insurance, you can have access to Lightpath Health primary care. We are providing primary care during 2 care sites. We have a very community informed and community embedded model where we find trusted partners in the community that already exist. We don't come and build brick and mortar and spend money on resources in that way. We want all our resources to go toward actually providing those services to the community members in need. And so with that model, we first partnered with St. Luke Community United Methodist Church. It's a mouthful, but they are a church pillar in the community. Everyone knows them. They're well trusted. And so for the first year, we housed out of their church on Wednesdays and Thursdays, providing free primary care, free access to prescriptions through our partnership with Stellus RX, free labs through our partnership with CPL. And so what we know is that preventative care is ultimately the long-term strategy. You can do as much intervention as you want with chronic health, but unless you are providing an environment where people can go to see the doctor when they're sick, can come in and do physicals regularly, can have their medications managed, can get the labs to give them the insight necessary for them to make the life changes that are necessary. Unless all of those things are wrapped around. Additionally, we also leverage Catalyst Health Group and provide a care management team that does kind of the basic needs analysis. Is housing stable? Is transportation stable? Is food security an issue? And so with kind of this full wraparound service type of model, we're able to really see people moving toward better health. And so we exist in response to the health needs of our community. So we're constantly reevaluating what we are and what we offer at our care sites based off of what the community needs, not what we perceive their needs are. I always tell this story where, when we first started, we were like, transportation's going to be the biggest barrier. How do we get bus passes and all those? And then once we started surveying, we surveyed our neighbors, which we call our patients, our neighbors, we surveyed them and they said that it wasn't transportation, it was language. And that being able to go into the doctor's office and have someone speak your native tongue. And you think about it, when we go to the doctor, being understood is our primary concern, right? When you sit and tell your doctor about all the things that are ailing you, sometimes the requirement of translation is a barrier to feeling like they could trust healthcare systems. And so our provider is Spanish speaking, our front desk community health worker is Spanish speaking, because we know that we want to be what our neighbors need us to be. And so, yes, we are constantly always assessing the needs of the community and just trying to be what it is that our community is saying that they need, and as it relates to healthcare. And that's I think that's a pretty broad overview. I could talk about Lightpath endlessly. So I will let you guys interject with any other questions that you might have.
Yeah, that's actually a great overview. I have 2 quick just points of clarity. One, and this is something Michelle and I talked about weeks ago, but I just want to make sure everybody knows that Lightpath Health is for everybody, even though it was formed and in partnership with a church organization, that there's no statement of faith or anything like that. You guys just want to take good care of your neighbors. And then I think most of our listeners in Dallas probably know this, and we're heavy on healthcare people, but I read recently that there is as much as a 20-year gap on life expectancy between North Dallas and South Dallas zip codes.
Yes.
And so it is incredible to have someone like Lightpath and partnered with someone with the brilliance of Catalyst actually start to move that number?
Yes, we have those eight zip codes have the lowest life expectancy as well as the highest vulnerability to chronic disease. And so, and then comorbidity is really what we're finding is that it's not just one thing that they're having to overcome. They're having to overcome kind of the magnitude of lack of health lifelong. So as we're intervening and as we're establishing these relationships with our neighbors, we're realizing that there is usually a complex healthcare needs that are being presented. It's not just the, you know, as we go in and get our annual physical, we're often trying to also kind of create management plans and health plans that are going to be moving our neighbors toward better health and overcoming not one, but two, maybe even three chronic health diseases.
Yeah. And that's so how have you done moving that life expectancy already as such a new organization? Have you added 3 months? Have you added a year? I'm just kidding.
That's not fair.
I know. But so newer organization, making an impact, building that trust relationship. What impact have you made so far? Do you feel that you can either quantify or just storytell around?
So, right now as a young organization, our our drive is a lot around the number of neighbors that trust us and come to let us provide ongoing primary care. So with one site at St. Luke being up and running for this last year, we've seen over 100 neighbors establish care with us. And establishing care isn't just coming in for one visit. It's the ability to come in for your initial visit. It's coming in for physicals. It's going for labs. It's being coming alongside us and letting us establish a health plan that you are a willing participant in. It's being able to stay up on your prescriptions and keeping them filled and making sure that you take an active part in your health betterment. And so right now we have over 100 neighbors that are actively involved in that through our St. Luke location. And that's only with a day and a half of clinic days. And so we do see that there's an established need. I always tell people that we do quality over quantity. We are not a churn and burn. We don't want to have you come in and, give you a 5-minute appointment because we want to see everybody. We really are challenging our provider to provide really in-depth meetings with our neighbors. And so while 100 isn't everybody, it is, I think, a indicator of the type of quality that we provide to our neighbors because, our visits are averaging about 45 minutes. And if you go to a doctor's office, if you get 45 minutes with your doctor, you're doing really, really, really amazing things. But it's because we're sitting with our neighbors for longer periods of time and really helping them kind of co-create this plan for better health. But as of right now, we've served over 100. And then with our new site that we have opening up that I'm pretty excited about, we anticipate that we will be doing well over 300 neighbors in the next year.
Yeah, so that's pretty amazing. And I know you mentioned like hallmarks earlier of preventive care, but we're really talking about not preventive. Like these are our neighbors that have been outside of the healthcare system probably for years. So it's not, that's a lot to catch up on and a lot of layers to try to figure out how to get a care plan together. So it's amazing, I think, what you guys are doing through that whole scope of the work.
Yes, it's both intervention and prevention, but the long-term goal is definitely prevention. We're hoping that as we infiltrate the communities that we work in, that more people will see us as a resource to come to for that preventative care. This therefore impacting the numbers of people affected by chronic health conditions, unmanaged chronic health conditions.
That 100 and 300 patients, they're going to tell 900 patients. And in 2 years, we're going to catch up with you and you're going to have like 8 clinics and a waiting list to get in.
That is the hope. That is the hope. Catalyst Health Group is a physicians group and it's a for-profit physicians group that services all throughout North Texas. And there's a network of doctors. And so when you decide to be a part of it, you can pick and choose whichever location best suits you. And so the hope is that as we identify these areas of need, that we will create a network of care sites for people to be able to choose where they want to access their primary health care and be able to establish real meaningful relationships with our healthcare providers.
That's amazing. So Catalyst Health and Dr. Chris Crow and Stratify and Village Health Partners, I've followed all of them for years. So has Brett. They're definitely an organization that's actually trying to fix healthcare, which is really exciting. What led them, with all the incredible things they have going on in healthcare, what led them to do this? And then follow-up question, which I think you may have already answered in your answers, but I'm curious. It sounds like some of the things you're talking about, especially with some of the social determinants of health, are you guys tapping into like their ACO and all of their resources? So we have this teeny tiny little clinic, but you've got this 800-pound gorilla's knowledge.
Yes. I think that is what you said it is the thing that makes us different than a lot of other people doing the work, is that network. But going back to Dr. Crow is a small town guy like myself. He grew up in Hillsboro and I grew up in McGregor, Texas.
Oh.
And in these small towns, there was always a town doctor, if you will. There was a person that no matter where you were, you knew that you could go there and they would, be able to point you in the right direction or get you back feeling well enough to take on the next thing, right? And so when Catalyst Health Group started to engage in the southern parts of Dallas and trying to do COVID outreach and all of that, he left that experience feeling like, well, who's their person? Who's their town doctor? And because of that, it really was his passion for healthcare, but also just him envisioning a place where he could take all the things that he had learned from Catalyst Health Group and expand the Catalyst Health primary care model and bring it to the communities that lack the resources and healthcare to have it. It was literally just that simple. He saw the need. He had an intimate response to like, hey, like,
I can fix this.
Where's their town doctor, right?
Yeah.
And he started to pool resources to figure out a way to address that need. And, it sounds very simple, but it is a very complicated machine in the sense that Lightpath Health is still trying to replicate that Catalyst team-based care model, right? We're led by a provider. We want a comprehensive primary care. We want to create comprehensive primary care programs. So it's not just going to the doctor, but it's being able, like I said, to wrap around all of these services. And the way that we do that is by tapping into Stellus RX, which is under the Catalyst Health Group. And they deliver prescription meds. They provide prescription management services. They're really, they're really top of their field in that work. They're nationally renowned for the work that they're doing, but they provide to us at cost prescriptions and we transfer that cost. I mean, we don't transfer any of that cost to our neighbors. So our neighbors are accessing Stellus RX prescriptions and prescription management services for no cost. And then we're receiving it at practically no cost because of our partnership with Catalyst Health Group. Additionally, the care team management, that's a service that's provided to the Catalyst Health Group physicians group. So it is the social work arm of Catalyst Health Group. And so they're providing that support to us at no cost. And then additionally, our providers are completely supported by Catalyst Health Group right now. And that's through their corporate donation. So Catalyst Health Group is not only providing us people resources, but they're also backing us with financial resources to support the work that we do as well.
That's incredible.
So, yeah, it's an amazing, you think about founders all the time, and there's usually in nonprofit land, there's always a founder that kind of underwrites the organization and so the organization can grow. But having Catalyst Health Group be your founding source, both people and financial resources, has really allowed us to like hit the ground running. And it really was required because the work was so needed. And the runway for needs was a very short runway. As soon as we hit the ground, there was established need right there. So being able to have Catalyst Health Group kind of underwrite that. And it's really based off of Dr. Crow's passion for the work has been really, really critical.
Yeah, which I think is a big distinction. You talk about it, and I'm like, I don't want a listener to think that this is something that is, like a super mega giant like Optum Health. No, it's still a local. It's a local
giant,
a local
Yes.
giant with real people affecting real people, which is just still really cool in this
a
day
local
and age.
brain trust.
Exactly.
Yeah.
It's still limited resources. I mean, I would say that as an executive director taking over a fairly young organization doing such big work, the financial support is immeasurable to the amount of support I've gotten just through the knowledge of healthcare. That it's just been invaluable to the work that we do. And so, yeah, I'm really proud of I say partnership, and I say partnership in the sense that we are nonprofit, they are for profit. There is a separation in that regard, but they have come alongside us and taken us under their wings in ways that really equip us to do amazing work.
Yeah. Well, without giving them the whole time and shining the light, we want to give some back to you. I know you say you don't like talking about yourself, but you have a long journey, both behind you and ahead of you. And with that journey and your experience in social work and your education, how has that influenced your approach towards taking care of people?
I kind of say it all the time. My personal why, the thing that drives me is two-part. I believe representation matters, and all that I am representing in leadership really does allow for access from other people that I may represent. But then additionally, my social work heart comes from this insatiable desire to right wrongs and to serve others, right? And so I think the way that I approach leadership, the way that I approach organizational development is always from a servant leadership mindset, in the sense that I'm constantly looking and building the organization from the community, right? I don't start with my ideas and then push them down and then hope and pray that they work. I'm a frontline fundraiser. I'm frontline social worker, no matter where I am in the system, right? I'm constantly imagining myself sitting across from those that are accessing the services in which I'm stewarding. And so I think that's what drives me. And I think that's what often makes me unique in the spaces that I drive, that I find myself in. A lot of nonprofits are run by people that have had for-profit careers. And then this is their last chapter, this giving back chapter. And then I find that me being a social worker innately and both professionally, I've always been servant minded. And I find that as I build out infrastructures, as I build out organizational policies, as I build out programs, I'm constantly always thinking about how it impacts the person coming through the door, accessing the services. And I think that having that viewpoint is the thing that I don't find that you always have in all of these spaces, though you would like to.
Yeah. And I so want to dig into the mindset of being the person to help right the wrongs, because I think that's so cool that you look at it that way. But I won't go into that because I feel like that could take us for a whole other 30 minutes.
It's just, I'm just the Robin Hood, right? I'm just the person that I'm empathic. And so I think that's what drives that, is that when you're constantly seeing the world through the eyes of the others that are around you, you tend to problem solve from that way as well. So that's really what it is.
I feel like that actually makes you the exact perfect person to be the executive director there too, because as somebody who spent a lot of my career running clinics, not necessarily nonprofit clinics, you often have to put the brakes on during meetings and bring everybody back to what's good for our patients? What does
Yeah.
everybody need? And so I love that that's your starting point. Your starting
Yes.
point is, what do our neighbors need?
Yes. And I think we are blessed in the sense that because we are no cost, there is no pay model technically that my program staff are having to constantly be berated about.
Yeah.
But that just leaves the work for leadership and for my board and for myself to really do the intentional work of partnering with people like you and partnering with other community stakeholders and telling the story so that I'm able to, yeah, keep the focus on service.
Yeah, for sure. Well, I know you guys are a young organization, but you've accomplished a lot in a pretty short amount of time, and you strike me as somebody that you're going to keep doing that and keep growing and keep improving. So, what's next for you guys?
So I kind of alluded to it. Our big what's next and the first 90 days of me joining Lightpath, we're really focused on launching our second site. And our second site is exciting because it's our first like permanent site. While at St. Luke, we have a designated exam room. Our like lobby, our welcoming area is a mobile. We pick it up and prop it down every time that we go. Our second site is in partnership with Cedar Crest Community Center, which is a amazing community center. It took the place of Salvation Army that had been in the neighborhood for many, many years, and it's doing amazing work. But part of the work was bringing in partners that meet the express needs of the community of Cedar Crest. And one of those needs was healthcare. And so we were able to establish our first actual, like, full on care site. It has a lobby, it has our exam room, it's our own designated space. It's just a beautiful, beautiful space. And we just launched it at the end of April, and we've already started seeing neighbors in the Cedar Crest community. And so as I talked about the 100 served through St. Luke, I am envisioning that our second site will see well over that, at least 200 neighbors. We're hoping that we'll be able to establish primary care at that site. And then for the future, it's it's going where the need is, right? And so as we've established that the southern sectors of Dallas is in need, there's also lots of rural areas touching DFW that are equally looking for their town doctors. And so the growth is really me getting out and hitting the pavement and figuring out where the need is and beginning the work of building another care site so that we can serve more people. I really am passionate in the sense that I want to make sure that every care site is uniquely formed and equipped to meet the needs of the community in which it's situated in. And so those processes take a little bit of time and a little bit of vetting to make sure that there's an exact fit. It's not just a matter of setting them up everywhere because that would be a little too simple of a model. But yeah, my growth, my hope for the future is that Site 2 takes off and does the work that I know that it's going to do in the Cedar Crest community and all those that can reach that site. And then that I'm able to focus my efforts on making sure that the neighbors in our community know that we're there for them, as well as going and seeking out other communities that might be in need.
It's so cool to hear you talk about making sure that the next clinic's not just the cookie cutter dropped in there, but you're making sure it fits where you're dropping and who you're dropping.
Yes.
Not dropping, building. You're investing, growing around, growing together. It's fantastic.
Yeah.
And super
We always say
inspiring.
embedding. We want to embed ourselves
Mhm.
into the culture that's already existing there in the community. So
Nice. So as you're looking for that, you're providing inspiration for us. At the same time, you've got to keep like inspiration fulfilling your creativity side, your soul. So what kind of organizations do you turn to for inspiration or growth, either in this field or outside of it?
you know, I there's two things that fill my tank. I am a forever learner. So leadership development, specifically leadership development around female empowerment. I'm always driven to those. Most recently, there's a movement called conscious capitalism. There's a Dallas chapter in which there's, like-minded business leaders that are focused on, doing the work of capitalism, but in a way that betters the communities in which they serve. And so that has been an organization that I've really taken a liking to quite recently. Actually, it's been around for a while, but it's fairly new concept for me, coming from mostly nonprofit worlds. Hearing about conscious capitalism, I was like, for real, what does that mean? And so, but then you get into the network and you realize that there's a lot of corporate partners out there that are really trying to do the work in a way that is representative of the communities in which they serve, and that it's providing dignity to the people that are there serving. And so I have really been into that, as I think mostly as I'm building a network in the Dallas area. Finding the people that are like-minded is always great. And then additionally, I quite frankly, it has nothing to do with nonprofit or any of that. I'm an aunt to AAU basketball player and a club volleyball player. And so that fills my tank. Being able to watch my nieces play youth sports, it's a new world out there. From when I played, and I had the pleasure of playing in college, and it was as simple as me going to high school and playing. But now it's just a whole new world. And so I spend a lot of my time doing club volleyball and AAU basketball. So those are the things that fill my tank.
Those are so fun. I'm glad you got the width and breadth of inspiration. And
yes. Family is super important. It drives me, making sure this world is one that's going to be livable for my nieces. It's pretty cool.
Really cool. All right. So the big ask, what can our community do to help support Lightpath in your journey? As well as, I know we talked a lot about Catalyst and all their investment. I'm assuming at someday they can't keep funding it all. So I'm sure you're also on the fundraising path at some point in time.
Yeah. Yes. As it relates to, it's about connection. I always say that my call to action is always going to be about telling people about us and being an ambassador for the work that we do, following us on our socials. Because we're fairly young, the impact of just being able to be followed on LinkedIn, followed on Facebook, shared when we do really great work is invaluable. And then, of course, we are a nonprofit that is currently supported. Yes, and I spoke a lot about Catalyst Health Group because they are our founding funder, but we also are seeking funding from individuals that are just passionate about the work that we do. We're seeking funding and support from corporations that are in alignment with the work that we do. And so there's the ability to donate or to connect me or the organization with potential partners is always invaluable. And you can always donate by going to our website. It's pretty simple, lightpathhealth.org. And there's a way to donate there. And then as we grow and as we do community events, I'm always partnering and looking for physicians that are looking to volunteer their time. Right now, we have a provider in all of our care sites because we want to make sure there's continuity in care and that they're seeing the same person. But as we go into community events and do physicals, where we went to Lincoln High School and did 103 physicals in one day with one provider, there's always needs for volunteer opportunities. And so just staying connected to us through our website, you'll see those volunteer opportunities pop up as well.
Michelle, thanks so much for the time you spent with us and all the investment you put into the communities that we live in and you're embedding yourself in, because it's such a pleasure to know you're right there.
Well, thank you. And I really enjoyed this time. And I just appreciate being invited here to share.
Wow. Are you impressed with Lightpath Health? I am. I love Michelle's servant heart and that she's instead of a frontline social worker, regardless of her title. Keeping the needs of their neighbors as the number one priority, paired with a brain trust like Catalyst Health, will make this small nonprofit incredibly impactful. Find them at lightpathhealth.org.